and I'd say in 7 or 8 years in New Zealand, you can expect us to have about half of the current primary care workforce still working. You've got a bunch of doctors and practice nurses that are, I think the average age is in the late 50s. So they'll get to a stage where they're no longer working and retiring. And so you either train more through medical schools, and general practice isn't that attractive, or you import more. But even with both of those, we just never make up the numbers at all. So we've been losing numbers and numbers. If you go to Rotorua,
Mm.
there's primary care clinics at the moment that don't have doctors because they haven't got doctors. And that was this time last year. So I assume that that's spread more through New Zealand at the moment. That's not an uncommon thing. So we have to have a functioning workforce that allows doctors and experienced practice nurses and nurse prescribers to work at the top of their game. The only way to do that is to use something like health coaches and health improvement practitioners to take some of that load, and that can be done. So now, actually, if you've got behavioural medicine as your number one thing that you do in your practice, then the doctor can work at the top of their game. They can be prescribing for complex cases and often de-prescribing and managing complexity. It's a far more beautiful way and hopeful way of practicing medicine than we've seen in such a long time. And there are places doing that. So that's what Glenn Davis done. That's what Olivia Curry does in Christchurch. It's a very different way of practicing medicine.